Healthcare premiums are set to go up for millions of Americans after Congress failed to extend Affordable Care Act enhanced premium tax credits, and those subsidies will expire tonight. According to analysis by KFF, the exact price hikes people could see depend on their insurance plan, age, household income, health status, and where they live. But says on average, costs will more than double for most enrollees. In 2025, the average payment was $888. In 2026, that payment is expected to rise to about $1,900. Alix Flores joins me now from Brownsville, Texas. He gets his health care through the Affordable Care Act marketplace. Alix, thank you so much for being here.
It's a pleasure to be here with you.
How will these changes impact your coverage in 2026?
So I am fortunate that I am able still to receive a subsidy, and it'll cover most of my premium. From last year's plan to this year's plan, I will have to incur co-payments around $300 each month. So that's out of pocket that's coming that I will have to pay to continue my current coverage.
And that is also because you will have to pay out of pocket for medication, right? Explain how you came to understand all of these increases.
So it is a very convoluted and very complicated process. And I am fortunate enough that I have a background in healthcare, and I worked in healthcare for 25 years, and I have a degree in public health. So for me, it is challenging. So I can imagine how it is for those that don't have as much knowledge. But every year, as I have to renew my plan, I always check to see that my PCP, my primary care provider, my medications will be covered. And I will make an adjustment to a different plan if it is not covered. This year, the medication I'm currently on, which is about $3,000 a month out of pocket, is not affordable. So my medication was covered at 0% out of pocket last year. And then this year I found out it was going to be 30% co-insurance, which meant I still had to pay $900 every month for that medication. So I got on the phone with healthcare.gov and I switched my plan to an HMO. And that HMO does cover that medication, but it's a copay of $50. So I have several other medications that I have to cover. So approximately $150 to $200 out of pocket will be for those medications.
What does that mean for your bottom line, having to fork over more money for basically what you were already getting this year?
It is going to be tight. My mom lives with me. I'm her caretaker, and that helps my income because I work with her 25 hours a week. But yeah, as everybody knows, food costs have gone up. Light bills, cable bills, all of that. So we'll just have to make some adjustments in what we buy each month. I'm lucky to live on the border between United States and Mexico, so I do a lot of shopping over there. And then I also have like my dental services there. So, it's just a matter of shifting. We probably won't go out to eat. We'll probably go out to eat once a month instead of 2 or 3 times a month. So we'll make those adjustments. But I know a lot of Americans are not able to.
Yeah, that's a very good point. Alix, I just want to ask you, so you have a background in healthcare, spent decades working in the healthcare field, still are. You have this degree in public health. You've been making the calls. You've been able to navigate the system. What is your message to lawmakers, not only on the fact that they weren't able to reach a consensus on this by the time these subsidies lapsed, but also just how hard it was to figure out how you were going to be impacted?
I've been working with my local representative, Vicente Gonzalez, and he's been great. His office has been great. I called this week to find out, am I really going to get the subsidy or not? And they were able to explain to me the enhanced premium tax credit versus the regular tax credit. At the beginning of the Affordable Care Act, there were tax credits, and it was based on income. And then in 2021, under Biden, they added the enhanced tax credit, which would include people making up to 400% of the federal poverty level, which allowed a lot of other people to get enrolled in the Affordable Care Act. So that's what's not being approved next year. It's the enhanced premium tax credit. That's what the Trump administration decided not to fund next year, but the regular premium tax credit will continue, and of course it's based on income. I am about 250% of the federal poverty level, so I qualify. but I know there's a lot of people who won't.
Well, we
So I
appreciate.
encourage legislators to work together to solve this because we are supposedly the #1 country in the world, and yet we can't have #1 healthcare. It is really incumbent on Republicans and Democrats to get together and improve what we have and make sure that everybody is covered, that is that is legally allowed to be covered, and also to prevent people from just falling off because they're so discouraged by the process.
Alix Flores, we really appreciate your time and your expertise in talking to
You're
us.
welcome.
Thank you.